USMLE style question on airway resistance in the bronchi. Question. A 45-year-old man with a history of asthma presents to the emergency department with acute shortness of breath and wheezing after exposure to dust. His respiratory rate is 24 min, and oxygen saturation is 92% on room air. Physical examination reveals prolonged expiration and diffuse bilateral wheezes. Which of the following airway structures contributes the greatest total airway resistance in a normal respiratory system? A. Trachea. B. Large bronchi generations 2 to 4. C. Terminal bronchioles. D. Alveolar ducts. E. Alveole. Answer and explanation. Correct answer, large bronchi generations 2-4. Explanation. Airway resistance law is determined by Poiseuille's law, which states that resistance is inversely proportional to the fourth power of the airway radius. However, total airway resistance is also affected by the number of parallel airways at each level. The trachea and large bronchi, generations 2 to 4, have the highest total resistance because they have a relatively small total cross-sectional area. As the airway branches further, the total cross-sectional area increases, leading to progressively lower resistance in the bronchioles and alveoli. In asthma, bronchoconstriction leads to increased airway resistance, especially in the bronchioles, which explains the wheezing and prolonged expiration seen in this patient. Why not the other choices? A. Trachea has higher individual resistance, but because it's a single structure, it contributes less total airway resistance compared to the large bronchi. C. Terminal bronchioles. These have low individual resistance, but their large number in parallel significantly reduces total resistance. D. Alveolar ducts have an even greater cross-sectional area, resulting in minimal resistance. E. Alveoli have negligible resistance because of their massive total surface area. Key learning points. Greatest total airway resistance occurs in the large bronchi, generations 2 to 4. Resistance decreases as total cross-sectional area increases in the smaller bronchioles. Asthma and COPD increase airway resistance, particularly in the small airways, bronchioles. Poiseuille's law, resistance, 1/2 radius square. Would you like a follow